The PACT Act, which received significant bipartisan support during its final passage after seeing opposition last week due to funding claims, is now headed to President Biden's desk, who's expected to sign it into law on Monday. Senator John Tester, who co-sponsored the bill, attributes the change in support to veterans and other citizens, letting senators know exactly how they feel on the matter.
When people make their voices heard in Washington, D.C., it can make a difference. And the veterans made their voices heard over the last week.
The PACT Act broadly addresses the health needs of toxic exposed veterans, but it also goes a bit further. Broken into 9 sections, the first 4 address health care coverage, expansion, and eligibility. It adds burn pit, additional Agent Orange, and other toxic exposure-related conditions to the VA's list of service presumptions. To get a VA disability rating, the disability must be connected to military service. For many health conditions, a vet needs to prove that their service caused the condition. This bill guarantees coverage for certain conditions. The PACT Act also creates a framework for the establishment of future presumptions, meaning the VA will be able to add conditions for coverage related to toxic exposure without an act of Congress, helping vets get coverage faster. Sections 5 and 6 establish research requirements and standards for health concerns related to toxic exposure through military service. And Sections 7 through 9 address VA resources such as medical facility leases, records updates and management, VA workforce recruitment and retention and funding for the programs. That funding came under scrutiny last week, with Republican senators saying they were voting against a procedural vote because they wanted $400 billion allocated set as discretionary funding rather than mandatory. Discretionary funding is what Congress decides each year to spend, while mandatory is guaranteed every year and takes legislation specifically addressing the funding to change it. Tester says mandatory funding is important in this case to provide stability for the new programs.
The mandatory is important because the funding is there. If you take away the funding, people are going to know it. You better have a good reason for it. And by the way, I'm not saying we shouldn't take away funding. We should take away funding, but this program should be allowed to work first. And then if it has more money than it needs, then we can adjust it back.
Veterans can already begin the process of receiving new benefits covered by the PACT Act. They can go to va.gov/PACT or visit our website for more information. Reporting in Helena, John Riley, MTN News.